Continuing the series, here we have the third episode of our pediatric series. Now, in the series, we're talking about children and the milestones that they have to achieve at every certain period of time, how at each level, what are the milestones to be achieved, and if they are not achieved, what you as a parent could do. So, the third episode in this is for the milestones that a 6-month-old infant should be achieving. And to talk about this, we have with us Siddharth again, our SLP, speech language pathologist. And today, so last time you spoke about this whole milestones and kids and how they have to achieve this. And we advise that parents come to us as early as possible.
Yes.
Now, let's say the child has moved on till 6 months of age, and now they start picking up these. Okay, so to begin with, what are the milestones at the 6 months?
So, if I have to be very brief, around a 6-month-old child should start, responding to name calls when the parent tells the child's name, or should at least start recognizing familiar sounds of the family members. And the child will also, in terms of speaking, the child starts saying ba ba da da, so starts babbling, what we call it as. And also the child, understands variations in the tone. If the parent is crying, the parent is angry, or the parent is very happy. So all these variations have to be noted in the child, and if the child is understanding them.
Okay, right. So, like you said, especially when it comes to speaking, I think I'm emphasizing on this point because I have seen this happen, at least with walking or grasping, they're able to see that they're struggling, but with speaking and swallowing, they just assume that it's okay. So what are these red flags that a parent needs to pick up on at this age?
So red flags, what I would say is, again, if the child is not looking towards an object that makes sounds, or the child is not turning the head towards the parent when the parent is calling the child, or the child seems very irritable, all the time crying. So all these are certain things which you can pick up on at this very young age.
Right. So once a parent sees a pattern in this, what are the steps that they can take, and what are they supposed to be doing?
So they can definitely get the child evaluated, and they can come for a evaluation for speech. Definitely, the child is very young to have an expressive vocabulary, but still we can maybe pick up on subtle things that if the child is responding well, or we can give some strategies and techniques wherein the child can improve. Like if the child is not responding from one side of the body, maybe the other side is betterly responsive and all that. So we pick up on that.
Right. So once they do come here, what do we do to help these kids?
So initially we do an assessment, and we find out what is the actual level of functioning of each child compared to the age of the child, and then we put them on certain techniques or certain strategies which can improve their understanding. So I had earlier mentioned that understanding and the listening comprehension has to develop first before the child starts speaking. So we need to pick up on that. So give them some toys, just check if the child is aware on how to use the toy. Is there exploratory behavior in the child? Does the child pick up the toy and look at it? Try to analyze what has to be done. So certain things like that. But again, every child varies and every strategy varies.
Right. If these signs are picked up on early, what is how does it help? So can the child go back to being on that normal graph?
Yes, it does help the child to achieve the normalcy graph, but I wouldn't say completely.
Okay.
Because there needs to be some intervention which has to happen very periodically from our side as well. So there are as I said, these techniques I can give them once, and they follow it up for 3 months and then come back to me or come back to another SLP.
It's a to and fro.
So it's a to and fro process where it has to be followed up very regularly.
Got it. Thank you so much.
Yeah,
Thank you.
welcome.
The next guest in this video to help us understand better about the 6-month infants, their milestones and everything else about it, we have Ms. Atira Dinesan. Hello ma'am, welcome. So Atira ma'am is a pediatric physiotherapist working with us, and she handles most of our cases, and I think you're the best person to get these insights from, ma'am. And ma'am, without further ado, what are the milestones that a 6-month infant is supposed to achieve?
So by 3 months the child will be able to do lifting the head from, if you put the child on the tummy, okay. From that the child should be able to give weight on the hands, okay. The child will give weight on the elbows. The child is able to do that weight shifting. Child will start for creeping. Creeping means that both the child will either do reciprocal creeping because one hand and one leg, or the child will use both the hands to go forward. Okay. So this is the first thing after 3 months once the child will start doing. Then the child will be able to do a lot of rolling from straight lying, it's called supine lying, to prone lying, and prone to supine. These are the 2 ways child will be able to do rolling. Then also the child will be able to do sitting. Sitting, the child will be able to do a ring sitting. The first will be the ring sitting, where the child hand will be in front to get the base of support. So the child will be first the child will get the hand support, then slowly the child will be able to lift one hand and take some objects. So these are the main things. By 6 months, 3 months to 6 to 7 months, 8 months, the child has to achieve these things. And the child will be able to, when the child is lying on the back, the child will be able to touch his or her hip, knee and ankle. So first the child will start touching the same side, then the child will start to touch the opposite side. Later, once the child is started touch to the ankle, the toes will come to the mouth. It's the mouthing will start, a lot of mouthing. By 5 months old, the child will start a lot of mouthing, where the child will know that okay, mouth can be used to explore object also. This is how the body schema develop. Most of the parents think okay, mouthing is not like it's not safe for the child should not touch things and put it in the mouth. Immediately they will take it off and they will restrict the child to put the thumb or something in the mouth. That is not the correct way. That's how the child will explore. Body schema will develop because of this mouthing. So you should not restrict the child to do mouthing. It will go up to 11 months, 12 months for some children. By 9 to 10 months, it's gradually reduced. But you should not be scared of okay, my child is taking things. So what you can do is you can sanitize all the toys and you can keep it. That's how the child will explore the things. So these are the major milestones that the child in terms of gross motor will develop. Then the other thing is that the child will be able to take things from the space. Like when the child is sitting something in the far, they will be able to take it. They will be also able to do pivot shifting, like they will be turn and take something from the opposite side. From if a toy is kept it on the left side, the child will use the right hand to turn and take it. So there will be a pivoting while sitting, and there will be also pivoting in creeping also. The child will if you keep some toys in front of the child and if you keep something on the side also, the child will try to turn and take it. So these are the major motor milestones that the child will have.
Right. So ma'am, what are the red flags in this age?
Yeah, so there are major red flag is that developmental delay, like the child is not rolling, the child is not creeping. So some of the children, they will not use the alternate creeping. So it's we say that alternate creeping, alternate use of alternate hand and leg, it's a primary way of, it will help in the later stage while walking. They have to use the alternate hand, like when you take the right leg, the left hand will swing. So the bilateral hand coordination is the one of the important thing when the child grows bigger. So creeping is important when the child use both the hands and both the legs. So that is one of the red flag if the child is not using alternate hand for creeping. The other thing is that it's called a reflex. There are certain type of reflexes which should integrate by 6 months. So there is one important reflex is called ATNR, okay, asymmetric tonic neck reflex. So this is called like when you turn the head to one side, the child will extend one hand, other hand will be flexed, okay. This is the position the child will be there. So when you turn to the opposite side, the turn side, the right hand, if the child is turning to the right hand, the right side, the right hand will be extended and left hand will be flexed. So this thing has to be integrated by 6 months, okay. If it is not, if it is still present, that's a red flag, okay. Then there is another one, that the child when sitting, if the child is going for a sacral sitting, okay, usually usually the child or adult, we will sit in the ischial tuberosity. If the child is going for a sacral sitting, the sacral sitting means the child is not sitting straight, child will go back and slouch. So this sitting is called sacral sitting. If the child has that sacral sitting, that is also a red flag that you have to consult the therapist or a pediatrician for that. So apart from the delay in the development, like these skills are not achieved by 6 to 7 months, these are the 3 major red flags that you have to check.
Right. Then, ma'am, so let's say there is a parent who's identified this, who brings them to one of our, some setup like this. What do we do to help such kids?
So first thing is that if we will check, there are the reflexes which should be integrated by these many months. We check whether the reflexes are still present. So integrating, helping the child to integrate those reflexes is the primary thing. So if the ATNR is still present, we should be make the child to position according to that. The side lying position, a lot of side lying position, rolling position. If the child is not doing, if the child has just skipped rolling, or maybe the child is not doing adequate rolling, the ATNR might be still persist. So we have to do these kind of reflex integrating postures or positions that we can teach or make the child to do. Then sitting exercise, like the child is not able to sit independently, corner sitting, we can help the child to do corner sitting. So the sitting, the child head control should be achieved. So if the shoulder is propped anteriorly, if the child is sitting with the shoulder anteriorly, we have to correct. When the shoulder is corrected, automatically the neck stability also will improve. So these minute things like positioning and strengthening of the neck muscles, basically on the all direction, like not only the front, there are muscles on the sides also. So the 4 areas we have to strengthen the muscles. So those muscles also we can strengthen. Then if the child is not doing adequate creeping, we can do postural stability exercises, equilibrium exercises. So these exercises will help them to understand or to do the locomotory tasks better.
Right. Thank you so much. Continuing our series on milestones and kids and developmental delays and all of that. Again, we have with us in conversation today Mr. Ganpati. Hello sir, welcome. Ganpati sir is the HOD of occupational therapy. He also has 17 years of experience in what he does, and sir also has a special interest in neonatal care, and he's also had experience in that field. So sir, continuing our 3rd episode now. In the previous episode, we discussed infants of 3 months of age and how the complications and delays could be in that age. So now for infants of 3 to 6 months of age, so what are the complications that we might find?
Okay, let's look at it like the gross motor milestone first, and then we'll go to the fine motor skills. So basically the gross motor is like the body and the leg part, how they move in a bigger muscles.
Right.
And the fine motor is like the upper extremity and then the hand, how they are using it.
Okay.
So the till 3 months, you expect some amount of head control, and you get a very good head control by the age of around 5 months. The child get a very good head control along with the hand control.
Okay.
So the head position may not change the hand much at the age of 5 months. So the improvement of head control is one part, partial head control by 3rd month usually people say, but the complete head control comes at the age of 5 months. So the head will be neutral when you put the baby in, we call supine position, that means on the back. That is one thing. And like at the age of around 4 months, what happens is, if you put the baby on tummy, they will roll back on their back, come back to their back position, which is called prone is on tummy, and come to supine position, which on the back they come that. And if you put the baby on, again you put on tummy, they start weight bearing on the hand, they'll just do push-ups. At the age of 3 months, approximately 3 to 4 months, what happens is the baby start weight bearing on the elbow when you put on tummy. That's an important position for the baby to get a better head control. So the head start moving against the gravity. The baby start lifting up the head. The neck muscles get called co-contraction. Both the sides muscle will contract together and hold. So this is one important milestone for the baby's visual exploration also. Because if the baby is on the supine position, that means on the back, just keep looking at the roof, isn't it? So the child has to explore the world. So the first position is on stomach, weight bearing on the elbow, and then come up. This happens from somewhere between 3 months to 4 months if this get matured. So the time of 4 to 5 months, what happens is they start weight bearing on the hand. They will start raising the chest up and then start looking up. So this neck extension, the neck going up, will help the baby to extend their elbow and hold and start looking up here and there. So the significance of this is like coming to elbow, coming to hand, is your center of gravity when the child born. If you put the child on stomach, what happens? The head position will have the center of the gravity. So the hip will be off the floor and the head will be down. So gradually raising it up will move the center of gravity downward. Ultimately the center of gravity should reach to the lower part of your spine. That is when the baby starts sitting. So this extension of neck muscles, extension of upper back and extension of lower back will shift the center of gravity towards the lower portion of the spinal cord. In the sensory spine, the bone, the backbone. So this will help the baby to sit better. So this is one important developmental milestone. You might have seen this, in asanas, like we say Bhujangasana. They will weight bear on that and then go up like a raised position. Okay. So that is another important significant milestone which happened between 4 months to 5 months. That happens. It should happen. And at the age of 5 months, another significant improvement happened is 5 to 6 months, somewhere between that time, is if you put the baby on back, the baby start rolling to tummy. Frequently they start rolling to tummy. So this rolling basically it starts somewhere from the 4th month to 6th month. This is how it will come, tummy to back, back to tummy. This rolling is frequently happening where your trunk's rotating so much so that the baby get control over their trunk movement. So now I told you earlier videos also, like each milestone which they are achieving, they are overcoming a pattern reflex, which is ingrained pattern reflexes. So I told you about the ATNR reflex, asymmetric tonic neck reflex, that when the head is turned towards one side, it will go like a bow and arrow position. So this has to overcome, the baby has to overcome that. So then they will start rolling thing. Same way that elbow weight bearing, hand weight bearing happens at the same time. That will overcome. There is another reflex called STNR, that is symmetric, means uniform. Symmetric tonic neck reflex. Based on the neck, the hand goes like, if I bend neck, hand goes like this, extend the neck, hand goes extension. So this reflex they have to overcome, because if the reflex is persisting, they cannot do movement away from the reflex pattern. For example, if this is like this, tight like this, they cannot roll. So this movement has to come away from this reflex so that they can take the rolling.
They need to break those patterns.
So that is another significant improvement at that time. And one more thing is, like at the age of around 4 to 5 months, 5 months approximately, now if you give your hand to the baby hold the hand. When they hold the hand, you pull, they will try to lift their head and come into sitting position. So there will not be any head lag. So if you check it before 3 months, there will be some amount of head lag and they will try to pull it up. But this time they will only pull self to come up, like your abdominal crunches you do, like that. They'll come. So these are all significance of this trunk muscles. And one more important milestone is the beginning of sitting. So at the age of around 6 months, so what happens is, when you make the baby sit, they will start weight bearing on the hand in the front, and they start maintaining that position. That's the beginning of sitting. And then they have to take one hand, two hand, and interaction start. By the time the baby become 7-8 months, no, they'll start sitting without any support.
Okay.
So this is the trial period for offloading the hand and trying to maintain the center of gravity properly. So one more significant happen at the age of 4 months to 5 months, you can say, is like if you make the baby stand position, they won't stand, but they do some straightening of the leg and start weight
they try
bearing.
to hold it.
Yes, they try to push the floor and then stand. So that is when, like when the baby become like around 7 months, 8 months, the leg engagement in mobility, all those things. It's a preparatory phase. Okay, then crawling has to happen, standing has to happen, all those things. These are all the preparatory phase. So if you see the gross motor, the bigger milestones from 4th month to 6th month, these are all the shift of the center of gravity from the top of the head to the spine, lower part of the spine.
Right.
So the ultimate achievement is sitting. So by the age of 6 months, the baby has to sit. So that is a preparation process. So if that is not achieved, then it's when you say red flag sign.
Flags.
So if you say 3 months head control, 4 months rolling,
Okay.
6th month rolling to tummy and sitting. These are the red flag. You have to notice that if it is achieved.
Okay.
If it is not achieved, it's a red flag. You have to approach an expert.
Right.
You can wait, of course, 1 month you can wait. That is a standard deviation anybody will have 1 month earlier on this thing. But one important thing you have to remember is any position, rolling from tummy to back or back to tummy, if they are doing these things before 3 months, that is an indicator. That is also a red flag sign.
Oh.
Why?
Okay.
Because if you have more tone, excessive tone, only baby will turn at the age of 2 months, all these things. So don't be happy that if your child doing rolling earlier, yes, because it may be a sign of
Something else.
excessive muscle tone.
Okay.
So that has to be paid attention.
Okay. So it shouldn't. It's not like a competition. They can't achieve it.
Mostly it will happen on tummy to back.
It should happen on time.
Yes. So when you put the baby on tummy, it's not only lifting their upper body, it should relax also. It should keep the head down and turn side to side. All these things should happen. If the baby has more tone at the back only, from the tummy they will fall back to that position. They cannot tolerate that position. So they will go back.
Okay.
So these are the things. So of course we have in the very earlier phase itself, we can pick up all this abnormal muscle tone, so that we will put an appropriate position, appropriate handling technique. How do you carry? All these things we will teach.
Right.
How do you carry the child? How do you position? How do you put the child in jula? What kind of jula you have to choose? What you have to avoid? All these things we have to teach them.
Right. So you touched upon red flags, and other than this major red flag, now the child should sit by 6 months. If it's not sitting, it's a red flag. Other than those major ones, are there any other red flags that a parent can pick up on?
The concern is, like I told, like each one has a quality, like how they do it. So when you say red flag signs, red flag for a therapist, red flag for the parents. In the sense, parent they can understand to a certain extent.
Correct. Right.
And the therapist can pick up so many other things. So these are the important red flag signs. Example of head control, sitting or rolling, weight bearing on the hand. All these things are important red flag signs which parent they can pick up.
Correct.
So there are many other red flag signs in the sense the indication for the developmental delay, which we see that clinically.
Right.
So that is quite complex.
And
in
that's
the
why
sense,
it's important to come for an evaluation on time.
Yes, that is quite complex because I told you the fetal angles. No, the fetal angles are important, and how the hand position is, how the neck position is. If you put the child and we observe the child on back, on stomach, we observe them. What kind of movement they are doing? What is the quality of the movement? How they are touching their leg?
Correct.
Are they taking their leg to close to mouth somewhere? Around 6 months and all, they'll start picking the hand leg to mouth. Around 9 months, you can see that the Krishna and all, they put their great toe in their mouth and these things. It's a tall typical developmental milestones which we can pick up much earlier with this angles.
Correct.
And also like sitting, how is their posture, how is their neck posture, symmetry of body, there's so many other things we will pick up.
Okay.
So for parents it's very important the outcome they have to see. What is the outcome? So we will analyze the cause also, what could be the possible causes and what are the minute problems also. We will be able to correct it, and very easily we can correct it. Simple intervention can change their entire life.
So I think I asked this question to Siddhartha SLP also, where if a parent comes for an evaluation and if they catch these and start therapy fast, does it help in bringing if, let's say there's a normal baby and there's a baby with all these difficulties. So if there is early intervention and therapy, does it bring their graph together? Like after an
yeah, more
intervention,
or
does
less.
it bring back
That's
to
what
normalcy?
the last session also I told. Like we call that mainstream child
Aha,
development.
yes,
No,
yes.
the mainstream child development. So you can have around a standard deviation of about 20%. You can have it.
Okay.
No problem actually. So 20% delay. You might have seen like some children they walk at 9th month, 10th month they start walking.
Yeah.
Some children walk at 1.5 year they walk at
Correct.
that. But that's
That's
okay.
okay.
That's okay. But this okay should not extend to 2 years, 3 years.
Right.
It's okay, he will walk.
Right.
That is not correct.
Therapy helps with that.
Yes. So there is definitely a difference between a normal child and abnormal child. If the child is falling between this standard deviation, that means 9th month to 1.5 year of walking, absolutely fine.
Okay.
Sitting from 5 month to 7th month, it is okay. 8th month, child is not sitting, then you have to address that. Why the child is not?
Right.
Maybe a small behavior change can move the child forward. See, one of the important, don't look at only from one big problem is we look at it from the muscle perspective. As soon as the child has a developmental disability, developmental problems, we all think it is a weakness, muscle weakness. So it is not muscle weakness. It has a lots of other aspect to that.
Muscle weakness is one of it?
One of it.
Okay.
One of it. Okay. So because the child is trying to gain muscles using his sensory input. So turning, lifting up, seeing, all these things have the sensory input also they have to get. So there may be a sensory problem which is causing these things. So we have to find out what is causing. So we have to find out what is causing this thing. Then we have to address that. So the one interesting question what you asked specific to this abnormal tone and all. Even a normal I told you last time also, even a normal child will have such reflexes.
Right.
So we should be able to pick up the abnormal reflexes earlier. What is abnormal? Then we have to address it. If
As
it is
a
normal,
therapist.
yes, as a therapist, yes.
Right. Right, sir. So these was all about the gross motor milestones. Are there any fine motor milestones for 6
Yeah,
months?
it's very, very important. Why this fine motor is very important is, you heard about intelligent quotient, no, IQ, right? That means like, how is your cognition? How is your, what do you say, mind working?
Understanding.
Understanding or comprehension about it, these things. So this aspect in early childhood, in the sense less than 1 year, no, is very difficult to understand. So this hand function is one way you can pick up that if there is any problem. Okay. So this is so important. Fine motor skills are very important. All your thought process, planning, everything is coming through your hand and you are executing it. So at the age of around 3 months, last time we have seen, you have seen this, the hand coming to midline. Otherwise it will be like this. It's a W hand position. So the baby start bringing the hand together. It will come to the midline.
Right.
Okay. And after that what happens? The hand crosses the midline.
Okay.
So this is how the hand crossing the midline connecting to rolling. So if the hand is not crossing midline, then the baby will not be able to roll. So these are all the nuances we notice that. So now when we work also we have to pay attention to that. Now if it is coming to midline, after that what? So till 3rd month, if you give something to your baby, they will just hold it. They don't know how to release. So the release preparation will start from 3rd month to 6th month. So you need a good release. You experience that. I'm not sure if you have experienced it. Some babies, they hold your hair,
Yeah, and they
but
don't let
they
go.
they
And they
don't
also
let
have
go.
very strong
Strong grip.
Yeah.
So this is called palmar grasp.
Okay.
You have a plantar grasp also. That means if you keep your finger on this part, the baby hold that. This is called palmar grasp.
Okay.
This is a what do you say, grasp which is related to your frontal lobe. So this frontal lobe release phenomena has to happen. That happened from 3rd month to 6th month. So if I hold an object, it's very important for me to release it. So now this bilateral activity is the beginning for that.
Okay.
At that time, what they do is, most of the time, third month to 6th month, they use both the hand to hold objects. You might have seen that both the hands they hold it, and both the hand they will do, and this kind of release will happen like this, and hold it, and that concept they are understanding. So after this, what happened is, at the age of around 5 months, the child initiate with one hand. They'll just try with one hand, hold with their one hand, and they'll just take it, shake it, and see, and they bang it on the, you might have seen children banging it on the hard surface and make some sound. So because the infant is always learning, they are not learned people, they are learning.
And it's very fascinating to see all of this.
So every motor attempt, they might practice at least minimum 10,000 times. Every motor attempt. So this banging they might have done 10,000 times. That holding they might have done 10,000 times to master it.
Correct.
That is when the neural networks are forming.
And then they move on to the next activity.
Yes. So they master the reflex, go to the next one. Master the reflex, go to the next one. So once they conquering these reflexes are the important step. And they go to, from the spinal cord, they conquer reflex, and then go to the equilibrium. And each one has to be connected to the brain.
Okay.
That is the master center, which gives a bigger plan for the execution of this thing. So one of these things is this banging. And once this banging happens, they shake. You might have seen that rattle and all. If you give 5-month-old baby, 3rd-month-old baby, you give a rattle, they won't shake like this.
Correct.
But 5-month-old baby, they will shake and see what is happening. So these are all sensory input. So this is at the 5th month, which happens. The baby start shaking it. After that, what happened is, an interesting thing happened at the 5th to 6th month is, the baby start transferring the object from one hand to another hand.
Oh, okay.
So this means, why it is so important is, this is when the release happened, the hand release happened, hand opening happened. Till then they just learning that, how I can manipulate the object.
So when parents scold kids for pulling hair, they don't know how to release.
They don't know how to release.
So sad.
Exactly. So they have to learn that. That is when, even in the foot also they have the grasp called plantar grasp. So that will go away by the age of 9 months. That is when they start walking. So see how nicely it is designed. Everything is designed very well, because the own sensory information is learning happening. So,
and we might not even notice, as caregivers or parents, we might not even notice this transfer happening.
Yes.
That is why it is important to have this knowledge as a therapist, for us to be able to pick up these developmental delays, because you won't notice. As a parent, you don't know, the child is transferred.
Happening. The learning is constantly happening. We may think that we are learning, but actually our brain is learning. We have to just allow it to learn.
Right.
So we think that our ego is telling we are learning, we are teaching.
True.
It's not happening like that. If you put the baby in the right environment, you give right toys. So that's why I told the grandparents know by instinct. They have not gone to school, they have not done occupational therapy, physiotherapy, but they know by instinct what to do, what not to do. The challenge is when it become abnormal. If it is normal, they know what is the joint. Only when it is abnormal, the challenge, you need an expert's opinion. Okay, and overdoing is also a problem, because out of curiosity you do too much is also a problem. So we have to pay a clear attention that if it is an abnormal, you have to meet an expert. It will help. So that is at the age of 6th month the transfers happen. That is the beginning for individual hand release.
Okay.
So that happens from 6th month to 7th month, they master that. Once they master it, the further skills develop. That is when this separation of hand and so many other things happen. So every month we are dividing it for our understanding. But every day there is a change. The brain change. There is some research done by this Penfield experience. So he has mapped the brain. So what he has done is he has to find out the cortical map of the hand or whichever part. He has to find out which part is for thumb, which for index finger, which is for middle finger. He has to find out that and map it on the brain. So what interesting finding he found is every 2 hours, if you change your behavior of using your hand or using your body, the entire map is changing.
Oh.
So the firing area itself changes.
Okay, so there's no one set area.
Yes, in the sense, if you tie these 2 fingers, then these 2 fingers in the brain will become 1 finger.
One place.
One place.
Okay. Oh.
And if you divide it, it will become 2.
Interesting.
So that flexibility is, so the learning for the infant and based on the sensory experience, imagine it's not happening in months, it's not happening in weeks, it's not days also. Every hour, every minute, every second, the sensory experience is teaching them.
Correct.
So our role is give them the right sensory experience for them to learn by themselves.
To learn and grow.
Yes.
Right, sir. So we've covered gross motor and fine motor milestones, and I think fine motor being so important, I think it's very difficult for parents to see these changes if they're not aware of all of this.
And one more thing, like how they hold, you have to observe. At the 6th month, they won't hold like this. The 6th month, you might have seen they hold like this.
Oh, okay.
This is called 4-finger grasp. All together, they will hold it like this. They will be like this, somewhere like this, and then they start releasing it.
Oh,
So
that
this
helps
has to,
them release
and
better?
then this comes like that, and then opening the thumb separately moving.
Right.
These are all happening till 1 year, and then mastering on that.
Interesting.
So this is how the fine motor skills develop.
So when there is so much involved and there's so much details, so as a therapist here, what do we do and how do we work with these small babies and help them overcome any abnormalities?
So there are different assessments you have to do, different levels. Like you have to do a skill level assessment, that is like how the child is playing, how they're interacting, how they're using their visual system to guide, auditory, hearing and guiding. All the things, it's a skill level. What kind of play the child is doing, what kind of you heard about the social smile, how is it age of 3.
They have to wave.
So the social smile is like they're not seeing actually. They're in the vision and the fine motor, there is a huge connection.
Okay.
So socialization also like that. So at the age of 3rd month, they are not clearly seeing your face. They're just smiling, something is moving.
Oh.
That much only they can see.
Okay.
But the 6th month only they are getting the vision. Actual the color vision what we are seeing. That's why you see some children they squint. Most of the time they squint. They'll try to see clearly.
That's why children toys are so colorful and bright.
To stimulate them.
Okay.
So the clearance of vision comes from 0 to 6th month.
Okay.
It
That's
is
when they
initially
start
fully
seeing
blurred
properly.
and then slowly increasing, then color add around the age of 4 to 5 months, and then get better vision after 6 months. The color vision. That is when they start identifying the strangers, new people, 6th month. Till then they will
Because
go,
they can
whoever
see the
lifting
face
they will
clearly.
go. So till the 6th month they will like. So there are so many other aspects, not only gross motor, fine motor, you have visual motor, you have socialization skills, you have that language skill development, and so many other things, aspects to that. So, so your question is like how you address that.
How
so
we here
that,
at Little
So I was talking about the skill level observation. Then you come to the next level, how this hand is working, how this body is working. As a gross motor, fine motor, developmental milestones. And we do a postural observation also, different posture we put, how is the child is managing the posture. And coming to the next part is the structure of the body, how is the muscles free or not, tight, spasticity is there, or I told tightness, contracture, some deformities there, all those things, and some sensory aspect to that, how the child is perceiving the sensation, getting it or not. All those things has to be assessed properly first. Once this assessment done, including the reflexes also, I told the different kind of reflexes has to be evaluated. Once you get a clear idea, okay, then you address the problem.
Okay. So
The assessment is very, very important.
thorough assessment.
According to me, your assessment is done properly, 75% of the treatment, not 50%, 75% of the treatment is done.
Right. Because it gives you a clear idea about the
Yes,
treatment.
yes. I'll give you an example. Like there was a baby of around 8 months. She was going to a place and the therapy was happening. Child was crying so much. So, some strengthening, some bridging activity. Bridging in the sense you the hip raising, like you do the strengthening of hip activity. Some weight bearing on the hand. All these things happen. Child is still not creeping.
Okay.
Moving forward. So the understanding is they may think it is shoulder weakness, it is hip weakness. It is not, because what I told is it's not just because of the muscle weakness baby is not crawling. Baby has not mastered the skill. You remember I told you that the equilibrium they have not achieved. So the simple thing to creep, what I advised is put the baby on your chest, on the baby's tummy, and tilt side to side.
Okay.
So what happens is when the baby know how to tilt side to side, they know how to move the extremity and go forward. So this is like how a lizard moves.
Their muscles was okay. They
Yes.
just didn't know the tilting part of
So
it.
every problem you have to understand properly so that you can address it quickly. You don't have to strengthen the muscles. You have to inhibit or elicit.
So we
some
can save
reflexes.
months of therapy on
Yes.
strengthening the muscles.
Yes,
Right.
yes. So it's all you have to find out why the baby not doing is one same problem, but why not doing may have 5 different reasons. So you have to find out that is important. And you take fine motor skills. For example, there may be infant, they will have something called cortical thumb. Thumb is inside the palm. So this is an indicator for the brain lesion. The excessive reflexive grasp also an indicator for the poor development.
Okay.
So now only when the baby hand open you can explore. Otherwise no sensory input happening from the hand. So this will block the speech development and so many other things also. Why? Because it's all adjacent to each other. You have to work on this to get the speech get better, or speech for the hand to get better. So it's all interconnected. In the brain it's all firing. The neighbor area will fire.
Right.
That's it. In your hand it is different. Hand is different. This is doing a different function. So we have to address all those things together holistically to get a better result.
Right. So I think the point of having a whole multidisciplinary team is to help in this
Yes,
evaluation
exactly.
from every aspect.
Exactly.
We see, we check with the child, and then we come up with a treatment plan. Right. So thank you so much, sir, for sharing all of it. So that was Mr. Siddharth, Mr. Ganapati and Ms. Athara, who has told you what all the baby should achieve by 6 months, what happens when it doesn't, what are the red flags, how can we help in those red flags. We hope these videos are bringing to you the holistic approach that we have for treatment in general. How we are coming to the video to you with 3 experts and all 3 of them giving their insights is exactly how we go to the treatment of the baby as well. So the child is taken care of in this facility. And if you know any child who might need our help, any parent who is a little frustrated, who is a little helpless, please do share this video with them. Subscribe to our channel and you will definitely get more pediatric related content from now on, and thank you for watching.